All right, what I want to show you this morning is how we're going to remove the skin from just one side of our pig so that we can start to see some of those superficial muscles, like the big muscles of the neck, the muscles of the back. We may be able to visualize some of the muscles on the stomach, on the ventral side. For these little guys, it's a little tougher. So if you have one of the larger pigs that were closer to full gestation, it'll be a lot easier to see those muscles. We'll also try to take a look at the big muscles up here of the cheek and the lower neck, and then maybe some muscles back here at the posterior end. So what you have to remember about your pig is that the skin is actually very, very thin. So you don't want to make really deep cuts, and you want to try to use two tools specifically, your scalpel and your blunt probe, to try to help sort of separate the tissues as you go. So I like to start with the pig lying on its dorsal side. Some people will tell you to tie the arms back. I usually don't do that, but it's up to you. I usually just kind of let the pig hug me as he would. So remember they're quadrupedal, so their little legs sort of hug you as you do this. And you want to start right up here underneath this little chin extension. And we're just going to cut down the midline very, very carefully, very superficial cuts, very shallow cuts, okay? And I'll show you, especially when you get down here around the abdomen, we really need to be careful because this is a very thin sort of tissue layer, and the important organs that we're going to be visualizing later are right underneath that surface. So we don't want to cut too deep and potentially cut through those organs. Okay, so we're going to start up here and just making little sort of scratching motions, and then you could use your other hand to sort of separate, and you'll see that you've already made it through the skin. Okay, so not too deep, just small. I'm really just making sort of scratching motions. Okay, and I've sort of decided already I'm going to go down, towards the left of midline if you're thinking about the pig, right of midline if you're thinking about your own perspective here. Okay, and it's always sort of a good rule of thumb to go either left or right of midline, because there's a lot of really important stuff in the middle. Okay, and we don't want to cut through that. All right, so there's sort of my first incision. Now I do want to sort of come up and around the legs. So we're just going to make a little incision here. That's going to start us up and around the legs. Eventually we'll just sort of, cut right off along here, just to show us where we're going to be removing that skin. There we go. Okay, and you can do the same thing over here on this side. But again, it's okay if you just want to focus on one side or the other of the pig. The nice thing about these pigs is that they have some bilateral symmetry to them. So whatever you see on one side, you're just going to see the same thing on the other side. Okay, and we want to come all the way down to about just right at the base of the leg. Okay. All right, now to take the skin off, you're going to start to sort of work your scalpel right underneath that top flap. Okay, and right as you're pulling the skin back, you'll see where the tissue is sort of holding on to that skin, and you just want to run your scalpel right along where that tension is at, and you can start to see those underlying muscles. So when you start to see those striated patterns, sort of stringy in the way that they appear, that's the muscles that we want to see. So we want to try to be careful not to cut through those. All right, so come up here and up and around the leg. All right, and all I'm doing is just running the very tip of my scalpel right along that edge, right along where the skin is in contact with the muscle layer underneath. Okay, just to get that separation. Okay, so there's a small portion of the underside of the neck. Now you can keep going up further up here and then do the same thing down here. So we'll take this flap of skin, we'll work our scalpel underneath there. Okay, if you need to, you can get out the forceps. All right, let me just demonstrate that. So you can take your forceps, right, and if you need to, you can use those to pull up that little flap of skin. I kind of like to get in there, so I like to use my hands more than anything. Right, and again, we're just running our scalpel right along that edge. Okay. So you'll keep using this method, all right, to remove the skin from one half of your pig. Right, and just to show you another little technique, you can also use this bent probe, and it's just as good at separating, if not better, because it doesn't cut like the scalpel does. So you'll be sure not to cut those muscles that you're wanting to see. Right, so you could take this blunt probe and just run it along that edge where we're pulling the skin back. Right, and it does a great job at separating the skin off. Okay, so this is the method that you want to use to remove just the skin from either one side or the other of your pig. Right, so don't feel the need to go on both sides, because you're going to see the same thing no matter which side you go on. That's the lovely thing about bilateral symmetry. Okay. So this is a great way to visualize those superficial muscles, and you're going to see that they are fairly faint, because remember that these fetal pigs, they've never taken a breath. So these muscles have not been oxygenized by their blood, which gives them that nice deep red color. So they're a little faint, but you should still be able to make out based off of following, you know, the patterns of those striations. Right, and certainly use your dissection guide to help you.